Good evening and welcome to our Sunday News Update. Gibraltar and the world may need to learn to live with the COVID-19 coronavirus if it becomes endemic like the flu or the common cold, and that may require us to rethink the way we live. That was one of the messages at today's press conference from Number Six Convent Place. Minister for Public Health John Cortes and Acting Medical Director Dr. Krish Rawal said in future we may need to place greater importance on good hygiene and good health in order to be better placed to fight the virus.
If COVID-19 becomes endemic and becomes a regular feature of the disease repertoire of our species, like the flu and the cold, and unless it mutates into a less virulent strain, we will need to learn to live with it. This means that living into our 70s, 80s and 90s may be more difficult than it has been in recent decades. We have to ensure that our over 70s are as fit and healthy as possible in order to be able to overcome COVID-19. As someone who is in his early 60s, this is sobering and worrying. It's a call to do something about fitness, weight, and for those who smoke, about smoking, health in general. We've always known it, now it's suddenly become urgent. It is quite possible that this novel coronavirus will become endemic, that it will become established in our repertoire of human diseases, like the cold and the flu. It is possible that it will mutate, not necessarily in a bad way. It may mutate to become less lethal. It's in the interest of every parasite, including a virus, not to kill its hosts, because if its host dies, it dies too. So it might mutate and be less, we don't know. But I think that we have to bear in mind that if it does retain a certain amount of the current lethality and it becomes endemic, we have to be much more careful in our social distancing, in our washing of hands. And how will the government respond? The government will respond in whatever way it has to, following the advice and tracking what the virus is doing.
We're desperately seeking an antibody test, and of course, many people are talking about vaccine. But these things, there is no vaccine for the common cold, and coronavirus is a cold. It's from the cold virus family. So the immune response in the body is not certain. I think the general feeling, albeit that the research is being looked at and is emerging, is that this will become just part of life. But isn't it interesting? Is no matter how complicated the research, no matter how many hundreds and hundreds of thousands of people have been affected, there are some very, very simple messages here that seem to be consistent and that seem to have helped, such as washing your hands, the social distancing. Now, whether we can social distance for the rest of our days, I suspect may be impossible. But of course, there are things we can do. We can think about this. We can reflect on this. We can be better with our hygiene. I'm sure we can, and with our washing our hands.
Dr. Cortes announced the current statistics on COVID-19 in Gibraltar, which showed no new confirmed cases since Thursday.
In the last 24 hours to 8:30 this morning, by statistics presented to us every morning promptly by Krish Rawal, who is here with me today, there were 30 attendances, of which only 3 were with COVID symptoms. All were swabbed. Of these 3, 1 was admitted to COVID CCU late yesterday. The patient is stable, not ventilated, and I believe the result was negative. Thank you, Krish, for that very latest update. As regards the tests, the grand totals, taking in the normal and the random 400, total swabs 1,912, pending 36, results received 1,876, negative 1,695, confirmed 132, active 12, recovered 120. As you can see, the recovered cases are almost the same as the total confirmed, with only 12 active. This is great to see, but please don't get complacent. Over the past few days, 2 reports in particular have come to my notice. One is the EU roadmap towards lifting containment measures, and another is an analysis and model for COVID-19 within the UK Overseas Territories, the OTs, prepared by Public Health England. The one on the OTs is relevant because of similarities in size and age composition. Interestingly, the projections for Gibraltar produced by Public Health England, assuming we had taken no containment measures, was an expectation of at least 300 deaths. Of course, with models, you can never tell exactly what would have happened. But fortunately, our measures so far have prevented this. But as I always say, we must not be complacent. The EU document concentrates on the process to reduce containment, or unlock, as we call it, and considers what has to be borne in mind before unlocking and how these steps should be taken. Spain yesterday announced some tentative plans for unlock, largely following the EU guidance. Our own situation will be informed by what's happening elsewhere, but clearly, as we have done so far, we'll take into account our particular circumstances. This isn't easy. It's a huge responsibility, like it was to deprive our people of basic freedoms. I don't know, but somehow this next stage feels more complex. And that is because we have got to get it right. If we are to prevent this deadly virus, I repeat, this deadly virus, from getting a hold on us. Remember the news we hear around the world. 800 dying still daily in the UK alone. We are just as susceptible to the virus in Gibraltar. We are not being spared by magic, nor because we are special. We must keep it at bay.
Dr. Cortes, who is also Minister for the Environment, said his ministry had received a report on the improvement in air quality since the lockdown, with further details to be revealed this week. He attributed this to factors including a reduction in traffic, and again highlighted the importance of respiratory health. With the Royal Gibraltar Police having banned access by car or motorbike to the beaches and Upper Rock this weekend, the Minister for Public Health criticised those members of the public who are using exercise as an excuse to go out and socialise, a sentiment echoed by Medical Director Dr. Krish Rawal.
Really just focus on doing some short exercise, get out there. The best thing by far and away is do some walking, do something that can maintain your social distance. But please, I would just ask you just to be aware that everybody else would like to do the same. So if we're maintaining social distancing, let's give everybody a chance. Let's go out for a short period of time and go straight home, keep safe, and allow everybody else the opportunity to do the same.
Dr. Rawal also reassured the public that the GHA has not forgotten the need for consultations, referrals and treatments for other medical conditions, such as chronic diseases and cancer.
So urgent and emergency treatments, of course, are ongoing, such as the 2-week wait for cancer referrals are still being managed. You may have noticed, in fact, I'm sure you have noticed that some of the format of how we would look after you has changed, and you may very well receive a phone call first, particularly from primary care, for example, and some of the consultants are making telephone calls as well to look after you and keep you at home and keep you away from the hospital where possible. But my medical teams are now looking very closely at what we can do at a time when perhaps we could argue that we have all this spare capacity. We give you the figures for the bed statistics. We have these teams ready on standby, all of this expertise, but we are not seeing the patients that we were anticipated at this moment from COVID. So all of this medical expertise is now concentrating on how we perhaps increase the number of patients that we see and look after and start working through some of those waiting lists. But the one thing I would have to say is that we are looking at this very closely based on very strict criteria. For example, how long perhaps you've been waiting, what medical issue it is that you're waiting to be seen for, what the procedure may be that you are expecting, the risk of waiting versus the risk of being exposed to COVID. We must always remember that we have patients who potentially may have COVID infection. And the one thing I can absolutely assure you is we will not put you at risk. And so that means that sometimes we may have to balance this risk and say that this is a medical condition that may have to wait, but we are absolutely looking at this.
Dr. Rawal gave further details on the GHA's preparedness for and response to the COVID-19 pandemic.
We have now, across all of the sites that the GHA covers, 756 beds, which is a pretty amazing figure, I would say, of which 333 occupied, 423 are free beds at the moment. And that's broken down to 205 beds at St Bernard's, 238 beds at the Nightingale facility, and 313 beds in total at the elderly residential services. So all of those areas we have moved beds around, we've consolidated, and we've increased our capacity very significantly. our CCU1, COVID CCU, was actually opened on the 23rd of March due to reconfiguration of the wards and moving of some of the facilities to different clean and dirty. You hear these terms, but essentially the wards that have the patients with the virus versus those that do not. So 23rd of March, and since in fact the first patient was admitted on the 24th, and as of the 18th of April, there have been a total of 13. That's only 13 patients admitted. 4 of those had COVID detected on a swab test, and 9 not detected. But at the time, of course, the admission was based on the clinical criteria and the clinical suspicion at that point. None of those patients have needed a ventilator. 1 needed some high-pressure oxygen through a mask. As the Minister says, we're doing extremely well now in terms of our discharges. We have had an overwhelming response to our call for care assistance. Over 300 people, in fact, have contacted us, and for this we are truly grateful. However, we're not accepting any further applications. We've trained 70 people so far, and this is enough for our staffing at the moment, and everybody else has contacted us. We'll keep your details, and we will contact you if we need it. But thank you very much indeed for contacting us and for volunteering to help.
Well, yesterday, Equality Minister Samantha Sacramento invited all children to draw a rainbow for people who are in hospital or in elderly residential services. They should be submitted to the Civil Contingencies Office and will be distributed among those in hospital wards, in ERS or the new Nightingale facility. The rainbow continues to be a symbol of hope. You've been displaying this on your windows, and it's with these images that we leave you tonight. Thanks for watching this news update on GBC Television. You can keep up with the latest on our website, gbc.gi, and our Facebook and Twitter pages. From myself and everyone here at Broadcasting House, good night. Stay indoors and stay safe.